Hey everyone, believe it or not, it's been about 6 weeks since the surgery. I thought I'd be able to do like a daily, maybe weekly update since then, but one thing I didn't realize after the surgery was just how exhausted I would be, just how tired and drained I was. I'm having to record and prepare everything that you want to say, and then recording it and then editing it is a lot of work. And so I thought I'd be able to do it pretty regularly, but with the rest and the daily walks that I was trying to do, at the end of the day I would be pretty tired, and that was for at least a good 3-4 weeks post-surgery. That's pretty much what I've been up to, but I have been recording videos since then, just waiting till I had enough energy to actually do some sort of on-cam and talk to you guys, now that my voice is a lot better since the surgery. So I wanted to talk about things more in depth that you might not have caught from the last video. So going back to June 4th, 2020, I woke up at 4:30 a.m. I had to be at the hospital by 5, so I got up, showered again with that special soap. My parents were up and ready also. My dad was there, and my mom, and we got into the RV and drove to the hospital. I checked into the same day surgery ward. From there, they brought me to this prep area where they had a whole bunch of beds set up, and I had to, behind a curtain, I had to wipe myself off with these special wipes that would disinfect my entire body and pretty much keep me clean and reduce the chance of any infection during the operation. I had to pay my copay. The full price of the surgery was about $135,000. Fortunately, my copay was only $2,500. So after I cleaned myself off, the nurse came and cleaned out my nostrils with some sort of iodine solution. She also had me brush my teeth with a special solution as well. An anesthesiologist came by and told me basically what I would expect. In addition to being under, he told me about the tubes that would be inserted into my chest, that I would have an IV on my hand, on my wrist, and then also on my neck. By around 7 a.m., I was already laying down on the bed, lying there and being wheeled, and as far as what I was thinking, I was just thankful, just being very thankful. I was pretty calm before they even gave me anything. There wasn't too much going on in my head other than just being thankful for everything that led up to this. Thankful for being able to catch this before it got worse, and all that. I remember somebody was directing traffic of other patients being prepared for the OR. It seemed like there was a couple other operations happening at the same time. Once I got into the operating room, there was about 6-7 people there waiting for me. And as soon as I got in, they started working on me like a pit crew does on a race car. They slid me over to the operating table, and everyone had a specific function. One person was hooking me up to the EKG. Someone else was putting blankets, really warm blankets over me to help calm me down. Another one was strapping my arms down to the bed, or to the arm post. There were arm posts, and another one was strapping me down, so that I guess as soon as I woke up again, I wouldn't be knocking things over or trying to remove any of my tubing or any of my IVs. And then the anesthesiologist put the mask over my face. From there, I closed my eyes. I thought about the people that I loved, and then I drifted off to sleep. So the actual surgery itself Prior to this happening, I'd gone online and did as much research as I could, learning about it. So with bypass surgery, once you're under, they saw open the middle of your chest, and they get through the breastplate, and your heart is exposed. Oh, they did insert tubes in my chest, so that it would drain out any liquids that would accumulate during the operation. From there, they hook you up to a machine that will do your breathing and your blood circulation for you. So it's basically an artificial heart and artificial lungs that will circulate the blood while while my heart was being operated on. Basically, what bypass heart surgery does is it creates another lane. If this was a highway, you could think of it as there being a car accident, except they can't move the car out of the way. And so what happens is that lane just gets super congested. So all they can do is basically create another lane. And the way that they do that is they source another artery from another part of the body, whether usually it's from the leg or from your arm, and they remove some of that artery out from your leg, and then attach it to your heart in the area over the area where there's a blockage, and create a bypass so that blood can flow into that artery, and then back into your main arteries, and then into your heart. And it was quadruple bypass because there was 4 blockages. And what qualifies as a blockage is if your arteries has more than a 70% blockage in that area. I had one here, 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 and here. So they put those grafts in, and then from there they start to close everything up. Once the grafts were put in, from what I remember, they closed the breastplate together again using titanium wire. So I'm really looking forward to the next time I've got to go through a metal detector to see if I set it off. And then they stitch everything back up. So the surgery started around 7:30 that morning. And then I remember waking up and regaining consciousness by around 4 p.m. I was in the ICU. There was a lot of people in there, medical staff already in there. I remember being incredibly groggy and unable to move. My arms were still strapped down. I still had all the IVs and all the tubing and everything still in me. And my first thought was, wow, it's done. So I remember closing my eyes again and giving a little prayer in my head, thanking God for, a successful surgery and for waking me up. I also remembered that I had a tube down my throat, and so I couldn't actually talk. I remember hearing someone from afar telling someone else that I'm ready for extubation. And, it was like a whole 2-3 minutes with that tube down my throat. And, that was probably the most uncomfortable I was throughout this entire experience, was having the tube down your throat. After about 2-3 minutes, I was given instructions on exhaling as they were preparing me to remove the tube. And they basically told me that I had to cough it up. They were going to count down, and then I had to cough it up while they would pull the thing. I counted down 3, 2, 1. I coughed, and they pulled that thing right out of my throat. I felt like Neo getting unplugged from the Matrix. It was not a good feeling at all. So when they finally got it out, I think the first thing I said was that my mouth was really dry. I don't think I had ever been that thirsty in my life. They told me that they would give me some ice chips, and she said they would be the most delicious ice chips I'll ever have in my life, and she was right. They didn't give me water. They didn't want me to start feeling nauseous or anything, so they stuck with the ice chips. And I must have downed 2 16-ounce cups of ice chips in like 20 minutes. After that, the nurses updated me, telling me that the surgeon had already called my parents, telling them that the surgery had went well. I was still extremely tired and wasn't really up for talking, and actually my voice, I realized that my voice was completely gone. And so I had to either whisper or really strain my voice, and so I held off on talking to my parents for a couple hours until I could muster up the strength to get on the phone. By around 7 o'clock that day, I was still very dehydrated, and talking was really hard. I'd never felt so physically drained in my entire life. But as soon as the nurse had seen that I'd woken up from my nap, she had me call my mom, and I finally got to talk. Spoke for about 5 minutes. The breathing tube had really affected my vocal cords, and it was very exhausting to talk. And even now, it's my vocal cords are not 100%. I remember my back killing me, and I asked to sit up in a chair. It took about 2 to 3 nurses to help me get up. It was, I had to get up very slowly, and they had to help my legs off of the bed, and sitting at the edge of the bed for a couple seconds, and then getting up, and I had nurses helping walk me over about 2-3 steps over to the chair, but I eventually made it. I had dinner on the chair. I remember my first meal was it was an all liquid meal consisting of soup and fruit juices. Since I'd been fasting since 10:30 the night before, it was I was really hungry, and so it was delicious, and I finished it pretty quickly. My chest was completely numbed up, and so was my leg. Basically, wherever they made the incisions was still completely numb from the anesthesia, but I was having a lot of back pain. I remember them giving me an injection. I think it was morphine, just having a really warm feeling. And I remember saying to myself, saying in my head, "See you all later," and then going to sleep. So the next day, day 2 and day 3 in the ICU, there was a pretty normal routine. Nurses would switch out every couple of hours. I was peeing through a catheter. I got a bunch of meds every morning. They checked my blood pressure every hour, and they also checked my glucose. I remember my second meal consisted of solid food, which was good. Also, an x-ray team would come by every morning to take a chest x-ray. My surgeon and my cardiologist both came in to check on me. There were about 2-3 other doctors that would also come by daily to see how I was doing. A respiratory therapist came by about 3-4 times a day to give me a breathing treatment, and also make sure that I was doing my incentive spirometer, which was that thing that one of my friends said looks like a bong. It's not a bong. That was helping me get the strength back as far as my breathing, so that I can cough and whatever liquid that was in my lungs, to be able to cough that out. I remember coughing was like the most difficult thing to do, and it hurt a lot. Every time I would cough, your entire chest would just feel pain, and so that's why they give you that little heart pillow to hold on to really tightly, so that when you cough, it splints the pain and reduces the how much it hurts. By the third day, a physical therapist came by and had me actually get up and do a couple of laps around the ICU floor. So by the end of the day, they also had my chest tubes removed, and I felt a lot better after that.
Wow, that's fine. Holy cow. Wait, how far in was that?
Those sit underneath your heart.
Oh, man.
By day 4, I was hoping that they would discharge me on that day, but my heart rate was still pretty high, so they wanted to keep me for another day for observation. I had a really great nurse, Nurse Debbie. Nurse Debbie was great, super pro, And she gave me a little bit of a history lesson as far as that the ICU floor that I was on. Apparently, it is an older portion of the building that they stopped using as an ICU unit, but when COVID happened, they dedicated their main ICU floor for COVID patients, and then they ended up moving all of the heart patients into this old section. And she had a cool little story about the history of where I was staying.
Yeah, little fun fact. He is sitting in the unit that is the pilot for Chicago Med. It was filmed here, and then the first couple episodes. So he is in the actual filming of where Chicago Med happened.
Yeah, I'm part of Chicago entertainment history.
That's right.
Also that day, I finally had my first bowel movement. I was very happy about that. I mean, if you could imagine, I had not taken a dump for about 3 days. And so that was a pretty good feeling. By the end of that day, I finally had my catheter removed, and that was pretty interesting.
Take a deep breath, and it's out.
Ooh, all right. How long was that thing there? I just wanted to...
About 12 inches.
Oh, wow.
By the 5th day, it was Monday. I went to the hospital on Thursday, and now Monday. My heart rate had lowered, had stabilized. It was about 100 beats per minute. So they were getting ready to discharge me. They had me do a little bit more respiratory therapy and more physical therapy. They had me go up and down a flight of stairs for the first time. It was very slow, but I did well. And then they also had the last of my wires removed. I still had a couple of wires in my chest, and when they removed that, that really sucked. And it didn't hurt so much, but it was more of a weird, gross, nauseating feeling of having wires that were up and down your chest and then being removed from your rib cage area. By around 5 o'clock, I was finally discharged. You know, a couple of the nurses told me that they really enjoyed having me there. I guess because I was such an easy patient, didn't really need a lot of attention. I was, you know, there were no complications during my stay there.
We've been doing well though. He's been my best patient. I'm sad to leave him go. He's been my
Glad
client.
I got that on video. For my next video, I'd like to open it up to you guys. If you guys have any questions regarding the operation, regarding you know, the tests that were done, leave a comment either in the comment section with a question, or if you want, or on my Facebook page, or message me, whatever. And in the next video, I'll take your questions and I'll answer whatever I might have missed, or if there was anything you want me to kind of talk about more in depth. Whether it's what did I really think of the food, or what did that specific machine that I saw do, to if I had thought that any of my nurses were cute. So yeah, looking forward to your questions. Thank you all again for watching and sticking with me all this time, and I look forward to talking to you all again soon.